Welcome to the very first episode of The Patient Talks. My name's Frank Smith. I'm a physician assistant, hence the capital P and A in The Patient Talks. This show is a medical education show. It's to help you understand what's going on in your life. This show is not about diagnosing your medical condition. Let me say that again. This show is not about diagnosing your medical condition. This show is predicated on the idea that you have already seen a clinician, have gotten a diagnosis, and need a little more understanding, a little more education on what's going on. The little tagline I came up here, understanding is part of healing. It's a little cheesy, but it's also the truth. I figured out early on in my career, a patient that understands what's going on simply tends to do better. I think it comes down to better the devil you know than the one you don't. There's nothing quite so terrifying as not knowing what's going on. Understanding helps diffuse that. Now, most clinicians do try to educate their patient, but they're on a limited time frame. The average office visit in the United States for family practice is 15 minutes. Now, that's door to door. That's from the time your clinician walks in the door until he or she walks out. That includes getting vital signs on you, getting a history of what was going on, doing the physical exam, rendering the diagnosis, writing whatever prescriptions they think necessary, and out the door. That is a very limited amount of time. And what ends up usually getting short-sighted is educating the patient. And frankly, sometimes you may not have that connection either. And that's not a dig against your clinician. Most people in medicine have gone high school, college, medical school, practice. That's what they've known. I've been blessed enough to have done a lot of different things before I ever got into medicine. I grew up in a very small town in southwest Arkansas. I grew up on a cattle farm. My father was a mechanic. My grandfather was a welder. My uncle was a teacher. My other uncle worked at a cement plant. I grew up with that extended nuclear family. I had a lot of exposure to a lot of different things there. And then when I got out on my own, I did a lot of different jobs before I went into medicine. I have worked as a waiter. I have worked as a disc jockey. I have done construction. I've done a little bit of everything. And the advantage that gives me when I'm talking with a patient is I can usually put the diagnosis in something that they understand so that they flat get it. Now, does that extrapolate to a web show? That's the $64,000 question, and we're going to find out. I'm aiming for this show to always be less than 10 minutes to kind of reflect the amount of time, frankly, that most clinicians wish they had extra to explain what's going on. This is my 25th year of practice. Everybody brings certain skills to their job. Using the mechanic analogy, one guy may be super good at doing alignments. Another one is very good at figuring out what's that rattle. Others are great at electrical, but everybody brings their thing to their job. For whatever reason, mine is that ability to explain things to a patient to where they get it. This month marks my 25th year in practice, and over the years, there's certain things that you end up honing, a certain phrasing that you end up kind of honing where you understand that patients really understand what's going on. And that's the main reason I've started doing this show is over the years, I can't tell you how many times I've had patients say, nobody has ever explained it that way to me before. So we're going to try. The one thing I can promise is if I say it here, I'm saying it at my job. I'm still in practice, hopefully for another 10 or 15 years. But if I say it here, I'm saying it there. And frankly, I've probably said it that week because it's going to remind me that would be a good topic to cover. As far as what we're going to cover, it's everything. We're going to cover lateral epicondylitis to what is high blood pressure, to what is type 1 diabetes, type 2 diabetes, all of that. We're also going to cover some things that my wife says nobody talks to their doctor about that. My answer to my wife is, but people talk to me about it, which means they should be talking to their doctor about it. I'm going to talk about stress. I'm going to talk about anxiety. I'm going to talk about loss and grief and how to work through some of the awful things that happen in life. One of the things that I tell my patients over and over and over is, if it's happening in your life, it's part of your health. And I need to know about it because it can have an impact. And if we both know what's going on, we may not be able to change a single thing about what happened, but maybe we can change how we attack it. So that's what the show's going to be, is me doing a whole lot of talking and hopefully making that connection that I'm able to make with patients in my normal practice. If you think the show has some possibilities, I guess there's a like and subscribe down here at the bottom. We're going to give this a shot. I plan on doing one show every week. This is my first one. I would like to think that the rest of them won't be quite as rough around the edges as this one. But hope to see you next week. Until then, get better, make me look good. Okay? Bye.